Your doctor may have checked the circulation in your legs during your last appointment. They may have asked whether you experience pain while walking, whether your feet feel cold, or whether you have noticed swelling around your ankles by the end of the day. They may have reviewed your cholesterol levels, monitored your blood pressure, and even discussed exercise as part of maintaining healthy mobility as you age. What they may not have fully explained, however, is that some of the most common leg problems seen in adults over 60 do not begin in the muscles, the joints, or even the blood vessels. In many cases, they begin much deeper within the nervous system itself, where a silent nutrient deficiency can gradually interfere with the communication pathways that allow your legs to function properly. By the time symptoms become obvious, that deficiency may have been developing for years. Most people associate leg health with circulation. If their legs feel weak, they assume it must be poor blood flow. If they struggle with balance, they blame aging. If they experience tingling, numbness, or burning sensations, they often assume these are unavoidable consequences of getting older. What many people do not realize is that healthy movement depends on a remarkably complex partnership between the brain, the spinal cord, the nerves, the muscles, and the circulatory system. When any part of that network begins to fail, the effects often appear first in the legs because the nerves serving the lower extremities are among the longest and most vulnerable in the entire body. Long before a person develops severe mobility issues, their body may already be sending subtle signals that something essential is missing. My name is Dr. Kaivor, and I have spent much of my career studying preventive medicine, healthy aging, and the biological factors that influence physical independence later in life. Today, I want to discuss one of the most overlooked nutrient deficiencies affecting leg health in older adults, explain the mechanisms through which it influences nerve function, muscle performance, balance, and mobility, and help you understand why identifying this deficiency early can sometimes prevent years of unnecessary decline. Before we begin, however, I want to make two things absolutely clear. First, not every leg problem is caused by a nutrient deficiency. Circulatory disorders, orthopedic conditions, neurological diseases, and many other medical issues can produce similar symptoms. Second, the information I am sharing today is intended to complement, not replace, professional medical evaluation. Understanding the mechanism is valuable, but proper diagnosis always requires individual assessment. The nutrient I want to focus on today is vitamin B12. To understand why vitamin B12 is so important for leg health, you must first understand what this vitamin actually does inside the body. Most people know vitamin B12 as something related to energy production, but its role extends far beyond preventing fatigue. Vitamin B12 is essential for maintaining the protective covering that surrounds nerves throughout the body. This covering, known as myelin, functions much like the insulation surrounding electrical wiring. Just as damaged insulation can interfere with the flow of electricity through a wire, damaged myelin can interfere with the transmission of signals through a nerve. Every movement you make, every sensation you feel, and every adjustment your body performs to maintain balance depends on these signals traveling efficiently between your brain and your muscles. When vitamin B12 levels begin declining, the body gradually loses its ability to maintain healthy myelin. At first, the damage may be subtle. A person may notice occasional tingling in the feet. They may experience brief episodes of numbness or a sensation that their feet are not responding quite as quickly as they once did. Because these symptoms often develop gradually, they are frequently dismissed as normal aging. The problem is that the underlying biological process does not stop simply because it is ignored. As vitamin B12 deficiency progresses, nerve communication becomes increasingly impaired. Signals traveling from the brain to the muscles become less efficient. sensory information traveling from the feet back to the brain becomes less accurate. Over time, the result can be weakness, instability, reduced coordination, and a growing sense that walking requires more effort than it once did. One of the reasons vitamin B12 deficiency becomes particularly common after the age of 60 involves changes in digestion that occur naturally with aging. Contrary to what many people assume, vitamin B12 deficiency is not always caused by poor dietary intake. In fact, many older adults consume adequate amounts of B12-containing foods while still developing deficiency. The reason is that vitamin B12 absorption is remarkably complex. Before the vitamin can enter the bloodstream, it must first be released from food by stomach acid and then bind to a specialized protein known as intrinsic factor. This complex is eventually absorbed in the small intestine. As people age, stomach acid production often declines. Certain medications further reduce acid levels. Conditions affecting the digestive tract may interfere with absorption. The result is that even individuals who appear to have adequate diets can gradually develop deficiency without realizing it. Research consistently demonstrates that vitamin B12 deficiency becomes increasingly common in older populations. Studies suggest that a significant percentage of adults over 60 have either outright deficiency or levels that fall into a borderline range associated with neurological symptoms. What makes this particularly concerning is that nerve tissue is highly sensitive to prolonged deficiency. Unlike fatigue, which may improve relatively quickly once a deficiency is corrected, neurological changes can become increasingly difficult to reverse the longer they remain untreated. This is one reason physicians pay close attention to unexplained numbness, balance problems, and walking difficulties in older adults. I remember a patient I will call Richard, a 69-year-old retired engineer who first came to see me because he felt unsteady while walking. He described the sensation not as weakness but as uncertainty. He felt less confident navigating stairs. Walking across uneven ground required greater concentration than it once had. At night, he occasionally noticed tingling in both feet, particularly when lying in bed. Because he remained active and otherwise healthy, he assumed these changes were simply part of getting older. During our evaluation, however, routine laboratory testing revealed a significant vitamin B12 deficiency. What was particularly interesting was that Richard's diet appeared reasonably balanced. He consumed animal products regularly and had never considered the possibility that absorption rather than intake might be the issue. After discussing the findings with his physician, Richard began treatment aimed at correcting the deficiency. Over the following months, the tingling gradually improved. His confidence while walking increased. The sensation of instability diminished significantly. What made his case memorable was not the deficiency itself, but how long he had accepted the symptoms as normal aging before discovering that an identifiable biological cause existed. The body had been providing clues for quite some time. The challenge was recognizing them for what they were. The relationship between vitamin B12 and leg health extends beyond nerve insulation alone. This vitamin also plays a crucial role in the production of red blood cells. Healthy red blood cells transport oxygen throughout the body, supplying tissues with the resources they need to function effectively. When vitamin B12 deficiency becomes severe, red blood cell production may be impaired, leading to a form of anemia. Reduced oxygen delivery can contribute to fatigue, reduced exercise tolerance, muscle weakness, and slower recovery following physical activity. In practical terms, this means that deficiency can affect leg function through multiple pathways simultaneously. Nerves may communicate less effectively. Muscles may receive less oxygen. Endurance may decline. The combined effect can produce a level of functional limitation that appears disproportionate to the severity of any single symptom. What makes this process particularly deceptive is that many people focus only on the most obvious complaint. They think about their aching knees, their reduced stamina, or their occasional numbness as separate issues. In reality, these symptoms may share a common biological contributor. The body does not organize problems according to medical specialties. A nutrient deficiency can influence multiple systems at the same time, creating a pattern that only becomes clear when the underlying mechanism is understood. Another important aspect of vitamin B12 deficiency involves proprioception, a term many people have never heard despite relying on it every day. Proprioception refers to your body's ability to sense its position in space. It allows you to walk without constantly looking at your feet. It helps you maintain balance while turning, stepping, or climbing stairs. Much of this information is transmitted through nerves that are particularly vulnerable to B12 deficiency. As nerve function deteriorates, proprioceptive accuracy may decline. A person may not describe this as a neurological problem. Instead, they simply say they feel less steady. They may hesitate before stepping off a curb. They may avoid walking in poorly lit environments. They may become increasingly fearful of falling without fully understanding why. These concerns are not trivial. Falls represent one of the leading causes of injury and loss of independence among older adults. While many factors contribute to fall risk, impaired nerve function is an important and often overlooked component. The ability to maintain balance depends on accurate communication between the feet, the nervous system, and the brain. When that communication becomes less reliable, stability often suffers. The encouraging news is that vitamin B12 deficiency is one of the most identifiable and potentially correctable contributors to declining nerve function. The key is recognizing it before years of deficiency create more substantial neurological consequences. Unfortunately, many people remain unaware that the symptoms they attribute to aging may actually represent a nutrient deficiency affecting one of the most important systems involved in maintaining leg health. And while nerve function may be the most important reason vitamin B12 deserves attention, it is not the only reason. In part 2, I want to discuss what happens when deficiency progresses further, why balance problems and falls become more common, how vitamin B12 is properly tested, and what practical steps adults over 60 can take to protect their mobility, independence, and long-term leg health. In Part 1, we discussed how vitamin B12 supports the protective covering surrounding nerves, why deficiency becomes increasingly common after the age of 60, and how seemingly unrelated symptoms such as tingling, numbness, instability, and leg weakness may all be connected through a common biological mechanism. What many people do not realize, however, is that the consequences of vitamin B12 deficiency rarely stop at mild discomfort. When deficiency remains undetected for long periods of time, the effects often extend beyond simple nerve irritation and begin influencing some of the most important functions required for maintaining independence later in life. This is where the conversation shifts from symptom management to quality of life. Because once mobility begins declining, nearly every aspect of physical health becomes more difficult to protect. One of the most significant consequences of prolonged vitamin B12 deficiency is its effect on balance. Most people think balance depends primarily on muscle strength, but balance is actually the result of continuous communication between multiple systems operating simultaneously. Your eyes provide visual information about your surroundings. Your inner ears monitor movement and orientation. Your muscles generate force and maintain posture. but none of these systems can function together effectively without the nervous system acting as the communication network that connects them. Every step you take requires your brain to receive information from your feet, process that information almost instantly, and send corrective signals back to the muscles responsible for maintaining stability. The entire process occurs so quickly that healthy individuals rarely notice it happening. The problem is that vitamin B12 deficiency interferes directly with the pathways responsible for transmitting those signals. As the protective myelin covering surrounding nerves becomes damaged, communication slows and becomes less reliable. Messages traveling from the feet toward the brain may arrive later than they should or contain incomplete information. The brain, in turn, has less accurate data available when making the countless micro-adjustments required to keep you upright. The result may initially appear subtle. A person becomes slightly less stable while walking in dim lighting. They feel uncertain on uneven surfaces. They instinctively reach for railings while using stairs. These changes are often dismissed as normal consequences of aging, but from a neurological perspective, they may represent evidence that the communication network supporting balance is beginning to deteriorate. Research examining older adults with vitamin B12 deficiency has repeatedly identified associations between low B12 levels and impaired gait, reduced balance performance, and increased fall risk. This relationship is particularly important because falls are not merely inconvenient events. They represent one of the leading causes of injury, hospitalization, disability, and loss of independence among older adults. A single fall can change the trajectory of a person's life. It can reduce confidence, limit activity, increase fear of movement, and create a cycle in which declining mobility leads to further physical decline. Understanding that vitamin B12 deficiency may contribute to this process highlights why early identification matters. I remember a patient I will call Patricia, a 74-year-old woman who remained remarkably active throughout her retirement. She enjoyed gardening, walking daily, and participating in community events several times each week. Over the course of approximately 2 years, however, she noticed a gradual change in her confidence while walking. She did not describe dizziness. She did not describe weakness. Instead, she repeatedly used the phrase, "I just don't trust my legs the way I used to." She became increasingly cautious on stairs and avoided walking outside after sunset because she felt less stable in low light conditions. Family members attributed the changes to aging. Patricia herself accepted the explanation. Yet further evaluation revealed a significant vitamin B12 deficiency that had likely been present for an extended period. What made her case particularly interesting was that many of her symptoms improved after the deficiency was addressed. While not every neurological symptom reverses completely, especially after prolonged deficiency, the improvement was substantial enough to restore much of the confidence she had lost. Her experience reinforced an observation I have made repeatedly throughout my career. People often assume mobility declines for mysterious reasons. In reality, there is frequently an underlying biological explanation waiting to be identified. Another important aspect of vitamin B12 deficiency involves muscle performance. Contrary to popular belief, muscles do not operate independently. Every muscle contraction begins as a signal originating within the nervous system. If communication between nerves and muscles becomes impaired, physical performance often declines even when the muscles themselves remain structurally healthy. This is one reason why some individuals with B12 deficiency describe their legs as feeling heavy, slow, or unreliable rather than overtly weak. The issue is not always a lack of muscle tissue. The issue may be reduced communication efficiency between the nervous system and the muscles responsible for movement. This distinction matters because it changes how symptoms are interpreted. Many people spend years focusing exclusively on strengthening exercises without realizing that part of the problem may involve nerve health rather than muscle health alone.